And speaking of fitness, your mental health is just as important as your physical health. Spectrum Health Medical Group psychiatry and behavioral medicine providers partner closely with primary care and other medical specialties throughout the Spectrum Health system. This integrated approach to care helps to heal both a patient's body and mind. Dr. Jared Skillings is the Chief of Behavioral Medicine with Spectrum Health Medical Group, and he's here to talk more about the importance of integrated behavioral health care. That's a mouthful. Good morning, doctor. How are you?
Good morning.
First off, can you explain what behavioral health is? What in a nutshell, if you could? I know it's probably a pretty broad topic.
Sure, I'd be happy to. Really, behavioral health affects everyone, and there are two main parts. The first part is illness, and the second part is wellness. So most of the time, historically, behavioral health is focused on things that have gone wrong, so the illness side. For example, there are about 1 in 5 people in our country who are diagnosed with a psychiatric disorder in any given year. Now, if you think about that, that's an awful lot of people. If you go to a concert or if you go to church and you look around the audience, that's a bunch of people. And the thing that's more troublesome is that about only half of them actually get any treatment. So on the illness side, imagine if we did that with diabetes or heart disease. If your mom calls you up and says, "Hey, sweetie, I just got diagnosed with heart disease," and they said, "Well, what are you going to do about it?" "Nothing. I'm not going to do anything." That just doesn't make any sense.
Not at all. And where
No.
do people usually turn to for help once they realize something's wrong?
That's a great question. So the primary place they turn is their primary care doctor.
Sure.
And so they go to their primary care doctor because they have a good relationship with them. And at Spectrum Health, we have some of the very best primary care doctors. And the second half of what behavioral health really means is the wellness side. And so primary care is about prevention. So when you talk to a primary care doctor, they're not only going to be able to help you with some of the mental illness side, but also be able to help work with you on trying to do some of the things that we all know we should do. Eat healthier, exercise more, but even things like take your medication more regularly. But that's also why we need behavioral health providers and why it's so important. Because primary care doctors have a lot of expertise, but we need psychologists, psychiatrists, and social workers to be able to work with them in partnership to be able to help move people from illness to health, or even from health to more health.
When you're talking about solving a problem, an illness, you brought up something that I picked up on. Preventative health care exists. We know what that is. Is there such a thing as preventative behavioral health care?
That's a great question. That is actually a newer field that's been emerging in the last few years. So what we know is that there's a trajectory for someone to go from health into illness. And so there's actually been a lot more research in the last while about trying to figure out what are the ways that we can set up barriers in your life so that way it prevents somebody from either having a recurrence if they've already been have had a mental illness, and or for people who have never had that happen to prevent you from ever having one to begin with. So absolutely.
That's good to hear. And then integrated care. That is a big part of Spectrum Health. Can you speak to what that means for, say, a patient from a patient's point of view?
Absolutely. Truth be told, your question about prevention is exactly why integrated care is so important. Okay. Integrated care means behavioral health providers working hand in hand with medical providers to be able to help take care of a person in a holistic way. Frankly, that's the reason that having a system is so important as well, because physicians can't do everything, psychologists can't do everything either, and so when we have a whole system set up, then we can take care of a person's body, mind, and spirit all in one. One quick example that we have, Spectrum is known for having some of the best technology and the best doctors, but behavioral health allows us to also provide the most personal care as well. So that way people would be able to understand, the providers would be able to understand people's values and what they want. We have a system now where doctors and psychologists, psychiatrists, and therapists can instant message each other. So when a patient is in an office, if you're sitting with your primary care doctor, they can send a message if you have some difficulty and you're seeing a therapist. They can send a message to the therapist and say, "Hey, Mary's sitting here with me. She's saying X, Y, and Z. Do you have any ideas, or what would you recommend to her?" And then Mary can get some suggestions about how to do better right on the spot instantly.
So it really it just makes sense to have all of those taking care of your health, whether it's physical or behavioral, to be able to talk to each other and share that information.
It is.
And this is something that you can say, behavioral science or behavioral health can save lives. And we all know physical health, you get cancer, diabetes, these things that can hurt hurt your body, behavioral health can help save lives as well.
It can. I think behavioral health is most known for changing lives, but one of the benefits of integrated care is that we meet people where they're at. Some of our providers actually work in the medical offices where patients go to care first, and so we've had several examples. We had an example just a couple of weeks ago where we had a lady who, because don't forget, the access in the community for behavioral health across the country is pretty poor. So we had a lady who had a real hard time getting in. She was tearful and she was so hopeless that she was just having a hard time figuring out how to pull it together. We were able to move some things around because of our integrated care program and be able to get her services. And the great thing is, when you hear these stories, this lady was so grateful to be able to have access in a way that we wouldn't have been able to provide if we were just doing traditional behavioral health. It was really fantastic.
Doctor, thank you so much for your time on the show this morning, and I'm encouraging anyone viewing this to get a hold of your team. Psychiatry and Behavioral Medicine is located at 2750 East Beltline Avenue, Northeast in Grand Rapids. Give Dr. Skillings a call, 616-447-5820. Thank you.